Today we will see the arteries of the upper limb. Here we see the red thing is the artery. It is the brachial artery, and then it is the artery of the forearm, the radial and ulnar artery, and the arteries of the hand. If we see the artery of the arm, it starts in the axilla as the axillary artery. Lower border of the teres major muscle. Here we see the teres major muscle, and the lower border of this muscle, the axillary artery named as the brachial artery, and it passes downward along with the nerves. We see the artery remains on the long head of the triceps muscle. This is the long head of the triceps muscle, and the muscle which lies lateral to this brachial artery is the coracobrachialis muscle and the biceps brachii muscle. And we see this muscle, this artery is very superficial in this arm. As it is superficial, so it helps us to measure our blood pressure in this brachial artery. Here we see that we use a cuff in this part of the hand, part of the arm, and we raise our pressure and we measure the pressure in this arm, as because the brachial artery is very superficial. So the anterior relation of this brachial artery is simple. One thing, the median nerve. You see the median nerve. This is the median nerve. It passes lateral to the artery, and in the lower part of this artery it crosses the artery, and finally it becomes as the medial relation of this artery. And there is, we see there is a bicipital aponeurosis. This bicipital aponeurosis passes over the brachial artery in this cubital fossa, and there is also a vein, that is the median cubital vein, that also passes over this artery. And on the medial side we can see this ulnar nerve remains throughout this course, and there is basilic vein that also passes in this medial side of this brachial artery. The artery in this hand, all the arteries give some muscular branches. The brachial artery also gives some muscular branches, and other branches of the brachial artery we see here. This is the brachial artery, and this is first branch of the brachial artery, that is the profunda brachii artery. It passes backward, and in the backside of this radius there is a spiral groove or radial groove. Through this groove, the profunda brachii artery along with the radial nerve that passes in the backside of the arm, and then it passes backward. This is the profunda brachii artery. This profunda brachii artery has a branch that supplies to the deltoid muscle. This is the muscular branch or branch to the deltoid, and there is a middle collateral branch that passes downward behind the humerus, and there is the radial collateral artery. So profunda brachii artery ends in dividing the radial collateral that passes anterior to the lateral epicondyle, and there is the middle collateral that passes behind the humerus. Now the second branch of the brachial artery. The second branch of the brachial artery is this is also collateral artery, and it is the ulnar side. So it is the ulnar collateral artery, and there is another ulnar collateral artery in the lower side. So it will name as the superior ulnar collateral artery. This will be the inferior ulnar collateral artery. So these are the branches of the brachial artery, main branches. Other branches, the muscular branch and some nutrient branches. So profunda brachii artery, superior ulnar collateral artery, inferior ulnar collateral artery, muscular branch, and the nutrient branch. These are the branches of the brachial artery. Then brachial artery passes in the cubital fossa, and finally in the neck of the radius. This artery divides into two arteries. Here we see the over the radial bone, this is the radial artery, and in the ulnar side, this is the ulnar artery. Now the radial artery. Here we see the terminal branches of the brachial artery. This lateral side is the radial artery, and in the medial side is the ulnar artery. The radial artery starts in this lower part of this cubital fossa, and it passes downward underneath the cover of this brachioradialis muscle, and this passes downward in the lower part of the hand. In the relation of the brachial artery, radial artery, you can see here is the origin of the radial artery, and it passes downward underneath this brachioradialis muscle, and in the lower part of this forearm we see that the artery remains very superficial, and it remains in between the tendon of the brachioradialis and the flexor carpi radialis muscle. This is the flexor carpi radialis muscle, tendon of the flexor carpi radialis muscle. This is the brachioradialis tendon. In between this, and this is very superficial. For this region, the radial pulse is felt here with this three finger in this part of the hand, part of the forearm. So this is the area where the radial pulsation is felt, and below this, the radial artery passes winds backward. Winds backward in the hand. Here we see this is the flexor compartment of the forearm, and here the radial artery crosses in the extensor compartment of the forearm and over the wrist. Here we see this is the tendon of the this is the tendon of the extensor pollicis brevis. This is the tendon of the extensor pollicis brevis, and this is the tendon of the extensor pollicis longus. In between, the radial artery passes over the wrist joint. This is the anatomical snap box. So radial artery crosses the anatomical snap box, and here we see this is the interosseous muscle. It is the dorsal interosseous muscle, and the first dorsal interosseous muscle. Through this first dorsal interosseous muscle, the radial artery enters into the palm of the hand. Here we see this is the radial artery. It winds round back side of the hand or wrist joint, and here we see this is the first interosseous muscle through which is pierced by this artery, and after piercing this first interosseous muscle, the radial artery enters into the palm of the hand through the two heads of the adductor pollicis muscle. This is the adductor pollicis muscle. It is the transverse head of the adductor pollicis. This is the oblique head of the transverse abductor pollicis. In between these two heads of this adductor pollicis muscle, the artery enters into the palm of the hand, forming the deep palmar arch. So this is the radial artery, and here we see the branches of the radial artery. The branches of the radial artery is the first branch. Here we see this is the recurrent radial branch. This is the radial recurrent artery. This is known as the radial recurrent artery. It passes upward, and here we see some muscular branches. This is the muscular branch to the flexor digitorum superficialis and other muscles. This is the muscular branches, and then we see here this is the superficial palmar radial branch. Here we see all the branches of the lower part of the radial artery. In the these are the this is the palmar side of the hand, and here we see this is the superficial palmar branch of the radial artery. Here is the palmar carpal branch of the radial artery, palmar carpal branch, and here we see after entering again in the palm of the hand, here this artery gives a branch. This is the princeps pollicis artery, which supplies the pollax or the thumb of the hand, princeps pollicis artery. Then it send a branch to the index finger. This is the radialis indicis artery, and here it sends the deep palmar artery, deep palmar arch. So the branches of the radial artery in this dots, this is the palmar side of the hand is the superficial palmar, princeps pollicis, indicis radialis, and the deep palmar arch. And in the dorsum of the hand, this artery has two branches. This is the dorsal carpal arteries. The dorsal carpal arteries or dorsal carpal arts. This is the dorsal carpal arteries. And here is another artery from the radial artery in the dorsal side of the hand. This is the first dorsal metacarpal artery. So in the back side there is two arteries. This is the dorsal carpal artery and the first dorsal metacarpal artery. These two arteries in the back side and in the front side, and these are the arteries. And in the above there is recurrent radial artery. These are the branches of the radial artery. This is the branch of the radial artery. Now the ulnar artery. Here we see this is the large branch of the brachial artery is the ulnar artery. Here we see the ulnar artery. It starts in this cubital fossa, and here we see, and the ulnar artery has many branches in this part. This is the anterior ulnar recurrent. There is another branch is the posterior ulnar recurrent, and there is the common interosseous, which divides into the anterior interosseous and the posterior interosseous, and some muscular branches in this part of this forearm. And in the lower part of this forearm and hand, it forms the superficial palmar arch. Here we see this is the superficial palmar arch, and before entering the superficial palmar arch, the ulnar artery has the carpal palmar branches, which unite with the branch of the carpal palmar branch of the radial artery, and here is a arch. This arch is known as the palmar carpal arch. And there is another branch before forming the superficial palmar arch. There is the deep palmar branch of the ulnar artery. This deep palmar branch of the ulnar artery unites with the deep palmar arch of the radial artery. So it forms the deep palmar arch. This is the deep palmar arch, and it is the superficial palmar arch. The branches of this superficial palmar arch are the palmar metacarpal arteries. This is the palmar metacarpal arteries, and there is another proper digital arteries. This also branch from this palmar arch, superficial palmar arch. 3 metacarpal and one palmar proper branch from this superficial palmar arch. These metacarpal arteries finally divides into the palmar proper digital arteries. In this little finger, ring finger, middle finger, and the ulnar side of the index finger. But this part of this index finger and the thumb is supplied by the deep palmar arch, the branches from the deep palmar arch. So this part of the hand is supplied by the superficial palmar arch, and this part of the hand is supplied by deep palmar arch. So these are the branches of the radial and ulnar arteries.